Hi there and greetings. My name is Dr. Thomas Satterwhite. Thank you so much for listening to this video. And I wanted to use this as an opportunity to talk about body contouring and more specifically what's referred to as body feminization. On a larger classification, this is more appropriate to refer it as body gender affirming surgery. So it's essentially doing a series of procedures to create and shape your body into the way that you want it to be, into the way that best captures your gender identity and, more importantly, your gender expression. With that being said, with body feminization specifically, I am using a set of procedures to create a body that has culturally defined feminine specifics. But once again, everything that I do is going to be tailored specifically to what you want to do, what your goals and what your expectations are, okay? So with that being said, the purpose of this video is to outline what to expect in terms of how to prepare before the operation, what to expect at the time of the consultation, what to expect during the operation, and then the post-operative recovery and potential complications and risks. So I really want to have everything laid out as clearly as possible for you, that everything's going to be very transparent, that there aren't going to be any surprises. I think going through gender affirming surgery, of course, can be a very stressful event, and it's my job, and certainly the job of my staff in my office, to ensure that you have a very, very smooth process. Okay. So with that being said, in terms of the consultation, what to expect? What's going to happen when you're interacting with me and interacting, with my staff at the time of the consultation? During our discussion, my number one priority, and I say this multiple times, certainly during this video and certainly when we have our consultation, but my number one priority is always going to be safety. So I'll spend several minutes going through your intake form, going through your medical history, just to point out anything that could potentially lead to complications, right? So I definitely want to take a close look at your medical history, your surgical history, your medications, just to make sure that we've optimized your safety as much as possible. So in essence, I'm looking for anything in your history, in your medications, any types of habits that you have that could potentially lead to bleeding, that could predispose you to blood clots, that could have adverse interactions with anesthesias. So in particular with your medical history, I'm going to be looking for a history of diabetes, because if you do have diabetes, so elevated sugar levels, that can actually lead to wound healing problems and complications. So we want to make sure that's optimized. If you've had any recent history of heart attacks or strokes or history of HIV, if you do have a history of HIV, certainly by no means is that a contraindication to moving forward, but we do want to make sure that your CD4 count is in an appropriate range and that your viral load is undetectable, so that you can be as safe as possible. And then the other things that I want to look for as well in your surgical history is to make sure that you haven't had any, if you've had operations on any parts of the operation, parts of the body that we're going to be operating on, or that I'm going to be operating on, that you don't have any history of extensive scarring, that there's no evidence of infection in that area. So for example, if we're planning on doing liposuction of the abdomen or a Brazilian butt lift, I think it's going to be important to make sure there aren't any scars in the abdomen that could potentially interfere with the operation. Or if we're going to be injecting fat into the hips and buttock region, that you don't have any once again, scars in that area or evidence of infection or anything that could potentially affect the overall results that you're going to have. If you've had a history of very extensive abdominal operations before in the past because of prior trauma or an accident or a very large hernia repair, or some other type of complicated abdominal operation, we may have to get imaging, such as a CAT scan beforehand, just to make sure everything is okay, that you have no evidence of a hernia or bowel or intestine that could potentially be in the area where I'm doing liposuctioning, because I don't want that to get affected by any means during the process. And then the other things that I'm going to be looking for, as well as your medications. So once again, making sure that you're not on any medications that could potentially lead to bleeding, such as ibuprofen or other NSAIDs, or Aleve, for example, or aspirin. Those are going to be important. If you are using hormones around the time of the operation, so feminizing hormones in particular, we may ask you to stop using those for a while before the operation, just to prevent the chance of you developing a blood clot, deep vein thromboses, or pulmonary emboli, which could potentially happen with body contouring procedures. So that's going to be important. And so we'll definitely go through those medications in detail to make sure we have that appropriately documented. And then the other things that I'll look for are allergies, certainly, to make sure there are no certain medications that you can't have. I want to be cognizant of that so we don't provide those to you, which can lead to an allergic reaction. And then other things that I'll look for: history of smoking, tobacco use, vaping, use of marijuana. For a lot of our patients, a good percentage of our patients do use marijuana, THC, or CBD. That in and of itself is not necessarily a contraindication for moving forward with an operation. What I do ask is that if there's anything that you're smoking, so cigarettes, vaping, marijuana, you do want to stop that for about a month before and a month after the operation, because that can lead to wound healing issues. So if you are using THC or CBD products or any of those derivatives, it is okay to use them around the time of the operation in general, but you want to use them as edibles and not as something that you're inhaling. So the general rule of thumb is that you don't want to be inhaling anything for a month before and a month after the operation. But once again, everything we do take on a case-by-case basis. And the other thing that I'll look for and talk with you about is your support. Like, what is your support system around you? Who do you count on? A significant other, family members, therapists? Going through body contouring procedures can be stressful, both physically and mentally. And so I want to make sure that you do have a support system around you so that in times of need, you do have someone or a group of people that you can reach out to, preferably several people. So once again, also having a very strong relationship with your therapist is important, because as you go through the operation, sometimes you can have, some negative feelings, sometimes depression or anxiety. And if you have a predisposition to that already, it's really important to have that therapist around the time of the operation, because if those feelings do start to come up, you can turn to someone that you do know and trust. And obviously, if there are any problems, during or after the operation, you can reach out to me, my office, my staff, and we're always available. But it is important to have a team around you that you do know and that you do trust to ensure that you do as well as possible. And then, ultimately, once we, the key thing that I do want you to keep in mind is that every procedure is going to be specific, right? They're not cookie cutter operations. There's not going to be, the same procedure that we're going to be doing for every single individual. But once again, as I said, first and foremost, going through medical history, optimizing safety, want to make sure that you are being as open and honest with me and my staff as possible. Rarely, if ever, will I say no to a patient who wants to move forward because of certain medical conditions. It's best to know what any medical, psychiatric, social issues are going on, because if we know that, up front, then we can find a way to help you to ensure that you're going to be as safe as possible, right? If there are issues with housing, issues with transportation, issues with having a caretaker, please, please, please let me and my team know that upfront so that we can make the appropriate arrangements, far enough in advance to ensure your safety and that you're going to have a good outcome. Okay, so once again, after we've gone through the medical history, social history, emotional, psychiatric history, then I do leave it to you as an open-ended question in terms of what your goals, what your wishes are in terms of moving forward with body feminization. So for the vast majority of patients who do want to move forward with body feminization, the number one procedure that patients want to move forward with is what's referred to as a Brazilian butt lift, okay? And what this involves, it's rather interesting because this procedure neither came from Brazil originally, nor is it necessarily a butt lift per se. But regardless, a Brazilian butt lift is what I think most of us are familiar with in terms of a procedure that involves a transfer of fat, typically from the abdomen and the flanks, and then transferring that fat into the hips and buttock region. And the goal, once again, of body feminization and Brazilian butt lift in particular is to create a feminine body, is to create a body that has that hourglass figure. So for many of our patients who do move forward with body feminization, they may have a body that is straight, where the abdomen and the flanks and the hips are one straight line, which can be deemed very masculine. That can lead to a lot of dysphoria, discomfort in clothing, can get to the point where it affects your safety, right? So body feminization is to, once again, create that feminine body, resolution of gender dysphoria. There are other aspects of body feminization or body gender affirming surgery that could also be considered. So some patients may want to move forward with an abdominoplasty, or what's referred to as a tummy tuck procedure. There are other procedures that involve the arms. For example, if you have extra tissue that's under the arms, so you have loose skin here, you may want to have that removed. Some patients may have loose skin that's within the inner aspect of the thighs and want that excised as part of a medial thigh lift. There are some patients who may not want to have fat injected into the butt and hips, but merely just want to have fat liposuctioned from the abdomen to create a tighter waist. So lots of different procedures. Once again, the priority for body gender affirming surgery is to create a body that is congruent with the type of gender expression that you want to have for yourself. So with that being said, let me focus on Brazilian butt lifts, because once again, that is a procedure that a lot of patients do ask for. But once again, I do want to emphasize that there are a whole host of different procedures, and we want to come up with something that is going to be specific to you and your goals and wishes. But once again, for the sake of the video, let's focus on what a Brazilian butt lift is. And so, for a lot of my patients, when I do ask for goals and expectations, I think what's going to be, helpful for vast majority of patients, patients want to have something that's going to be proportional, that matches their particular body type. There are some patients who may have specific goals where they want, the butt to be, the prominent feature. They want their hips to be the prominent feature, or where other patients say they want a combination of both. But once again, that's something that I'll ask you. I think what's also helpful to guide the discussion, and I'll ask you this as well at the time of the consultation, is to show me pictures, right, that you find as being the ideal body type. So going on the internet, going on my gallery and my website, and finding pictures of women's bodies or feminine bodies that you find particularly appealing. And I can use that as a guideline or as a template to let you know whether or not they can be achievable. So concerns can happen if you're a relatively thin person and you don't have much fat. Then it's going to be very, very difficult to find fat anywhere in your body that I'm going to be able to inject into your butt and hips. So there might be some patients where I've asked, you to gain, 5, 10, 15, sometimes 20 pounds in order to achieve, the type of body that you're looking for. So I've had, some patients who have shown me bodies where the hips and butt are really, really extreme, right? So examples for, Nicki Minaj, right? So that's a very, very extreme example, very difficult to achieve. Once again, very few patients do ask for that. But if you showed me a picture of Nicki Minaj and said you wanted to have your butt and hips to look like that, I would have to tell you, particularly if you were a thin person, I'd have to tell you that wouldn't be something that would be achievable. So once again, it's going to be the combination of what your goals and expectations are and the amount of fat that you have in your body that we can work with. There are some individuals who are, once again, very skinny, may not have enough fat to work with, aren't going to be able to gain weight. Then I may tell you that the best option might be getting implants. So getting, silicone implants or other types of implants that are placed into the butt or hip region. It's a procedure that I, myself have not done much of, and I will, in many cases, refer you to other surgeons who might have more experience in these areas. But for the time being, I rely primarily on using your own fat and on your own tissue. But once again, I'm always happy to discuss options to ensure that you're as informed as possible. And even if you don't move forward with me, I want to ensure that you are going to be appropriately informed. But once again, a large part of our discussion is going to be on what your goals and expectations are, and then and seeing if I can meet those goals and expectations based on the amount of fat that you might have in your body. Okay, and so then once we've done that, typically we will, have pictures beforehand of your body. We do take pictures, or you provide pictures to our office as part of the medical documentation, and we do this for all of our patients as well. Once we have determined, once we've had the consultation, then my administrative team will follow up with you. And what they'll do is they're going to talk with you about all the nitty-gritty logistical things. So they're going to talk with you about working with insurance, right? So I want to make sure that it's not going to be a huge financial burden for you. So my team will talk with you about what it means to work with insurance. If we're not able to work with insurance, what the out-of-pocket expenses would be for you. But once again, the vast majority of my patients, we do have a fairly good success of getting insurance coverage. And once again, my team will work with you very closely and do everything to advocate for you for getting insurance coverage, okay? And the other thing that my team will talk with you about is scheduling, right? They'll look at my calendar and find a date that will work with you in terms of moving forward with body gender affirming surgery. And as you think about a date for the operation, you want to keep in mind, that is going to be around a time where you can take off from work or school, or where you can have adequate support and adequate transportation and appropriate finances if needed in order to move forward. You want to make sure that everything is set up to ensure that you're going to have a smooth recovery on multiple levels. And once again, my team will talk with you about that. And so, as I said, we want to make that process transparent. We want to make it super clear that, you have a timeline that's set up, and my office will be in constant contact with you. Once we do get a date of the operation, once we've gotten appropriate insurance authorization, my team will maintain, constant contact. My nurse will typically reach out to you, several weeks before the operation, and they'll talk with you about, your medical history. They'll review your medical history, make sure there are no changes in your medical issues, no new operations that have come along. Want to make sure that there are no changes in your medications, that you're not smoking or using any nicotine or tobacco products. And then for many of our patients, we oftentimes get labs. So we do have blood draws, and then we'll work with your own primary care doctor to ensure that we get appropriate blood work. And this is typically for most patients, not all, but usually for most patients. And we'll take it once again from a case-by-case basis to determine if that's a necessity. And then if you do have any medical issues that need to be optimized, such as diabetes, heart condition, lung conditions, other things, then my nurses will work with you and your primary care doctor and your primary provider to ensure that those are optimized before moving forward with the operation. And then we have a pre-operative visit. So that'll be set up, with me or my team, typically, a day to, a week or so before the operation. At that point, we'll talk again about the operative plan. We'll revisit your goals and your expectations and make sure that everything is set up appropriately. We'll provide your all of the instructions, all of the post-operative instructions. We'll review with you, where the hospital and the facility is, or the surgical center that we may be using. We'll provide all of the medications and prescriptions. And then, of course, we'll be there to answer whatever questions, and then we get your consent or permission to move forward with the operation. On the day of the operation, we'll show up to the hospital or the surgical facility, and I operate at different places throughout the Bay Area, the San Francisco Bay Area, but you'll typically show up usually about, an hour and a half before the operation starts. Prior to that, we'll let you know which medications you need to not continue using. We'll also let you know what medications you do need to use around the time of the operation, because there are several medications for many of our patients that we have you start taking even before the operation to minimize pain and swelling and even nausea. And the other thing to keep in mind is that the day before the operation, so typically the night before, we do want you to stop eating at midnight. So you need to come in with an empty stomach, which is important to minimize nausea, to make sure that you don't have any adverse effects with the anesthesia. Because if you do have food in the stomach, that can cause you to have nausea, which can cause you to vomit during the time of the operation, which can actually go into the lungs and lead to pneumonia. So that's going to be a very important thing. And the other thing, just to back up a little bit, is that we'll work with you in terms of setting up and ensuring that you have appropriate lodging. So most patients do stay at local hotels, Airbnbs. We do have other types of facilities that are run by prior patients that offer discounted rates as well. So there's a whole host of different places that you'll be able to stay, which have been wonderful for many of our patients. So once again, on the day of the operation, once you've come in and checked in with the nurses and the anesthesiologist, you'll see me. We'll typically do markings on the body to plan out the operation. Once again, confirming the operative plan. You'll be brought to the operating room and you'll be asleep, okay? Operation for body contouring, depending on what we do, particularly for Brazilian butt lift, can be about, a few hours, can be, anywhere between 2 to 4 hours, and it's going to vary from person to person. So speaking specifically about, Brazilian butt lifts, what this entails during the operation, the first part is going to be liposuctioning. So this is the removal of fat. So this is taking fat from, all throughout the body, because this is going to be, the very first step. So what this removal of fat does is two things. So number one is going to be contouring. And then number two, it's going to be harvesting fat that we're going to be using to inject into other parts of your body to feminize it. So what areas of the body will we be doing the fat grafting, the fat harvesting from? So that's entirely up to you, and everyone's going to be a little bit different. So for the vast majority of patients, it's going to be the abdomen. So the front, so the upper part of the abdomen, the lower part of the abdomen. It can be the flanks, meaning the sides of the abdomen, which is going to be really important. So as part of the hourglass figure, we want to get that cinched aspect of the waist, right? And so I really do want to liposuction the sides of the abdomen so that everything is going to be nice and compact and tight. And that's going to be an important feminine feature. I also take fat for many patients from the lower back, sometimes the upper as well as the mid back and around the bra line as well, because you may have some bulging in that area that you're unhappy with. Also, we'll take fat from the inner part of the thighs, what's referred to as the medial thighs. If you have fat in your arms, we could do that as well in the upper arm region. Some patients have asked for taking fat from here. Most patients usually don't have a lot of fat in that location, but that oftentimes has been a donor site for patients. But this is going to be an extensive discussion that I have with you beforehand to talk about the areas that we want to take the fat from. So once again, I'll use liposuction, standard liposuction, to take fat from all of those areas throughout the body. And then once that fat has been taken out, we wash it, we clean it to make sure it's nice and pure fat, and then re-inject it throughout the butt and hip region. Once again, the first part of the operation is a liposuction, which contours the waist, okay? So you get that nice cinched waist. And then the next part to accentuate the hourglass figure is injecting the fat into the hips and buttocks so that there's more projection. So the one thing that you want to keep in mind, as I talked about before, is that a more masculine body is going to be kind of straight, kind of square, rectangular, as opposed to a more feminine body, which is going to be more hourglass. So that is what I'm converting your body into a more feminine figure. And so what I do is whatever fat that I have, I inject it using long cannulas but basically long, thin rods, but injecting that fat into the butt and hip region to create that appropriate contour. And once again, I will rely on your particular goals and expectations in terms of the areas that I want to place that fat. And as I said before, I may be limited based on the amount of fat that I'm able to get from you. If there's a lot of fat that I was able to liposuction, which is great, then I'll have a lot of fat that I can inject into the butt and hips. If I don't have a lot of fat, then I might have to distribute it more judiciously and focus on one area rather than on multiple areas. But once again, that's a discussion that we'll have and clarify. So once again, the operation does take a couple hours. All of the areas where I'm doing the liposuction and injecting the fat are going to be through these tiny little cannula sites, probably a couple millimeters in size. I close them with absorbable stitches, so nothing to have to take out later. And then for all of the areas where I have taken out the fat, right, so the abdomen, the legs, the thighs, you'll have some type of compressive wrap that you do need to wear around those areas to allow the area to heal and decrease the swelling. And then after the operation, you'll typically stay with us. Some patients do leave after the operation. Many patients do stay overnight. In our surgery center or in the hospital, and then we'll observe you, but we certainly take it case by case. But as it currently stands, most patients do like to at least stay overnight to make sure that they're doing well. And then once you're eating, you're walking around, your pain's controlled, then you'll be able to leave. If I'm doing an abdominoplasty, so for some patients, we may have to do an abdominoplasty because there might be excess, after taking out the fat, there might be some excess skin, which can obscure the result. So we might have to take out some of that skin. If an abdominoplasty is done, then you will have a lower incision, which tends to be really low on the abdomen. So it's going to be within your underwear line, so it's not going to be visible, and you'll typically have drains, 2 drains on either side that stay in for about a week. So that's one thing to keep in mind if that's an additional procedure that we do. And in terms of whether or not we do a tummy tuck at the same time as a Brazilian butt lift, I would certainly talk with you and provide my input and advice as to whether or not that would be something that we need to do in conjunction. Regardless, after the operation, once you're doing well, then you'll be able to leave, and then you'll stay here in the San Francisco Bay Area, and then you'll come back a week later. During that time, it's typically okay to take a shower, keeping the incisions clean, usually applying a little bit of antibiotic ointment to the small cannula sites, and then covering them with small dressings or Band-Aids during that time. What's going to be really important post-operatively is wearing compression on the areas where we've taken out the fat, and then avoiding direct pressure on the areas where I've injected fat, okay? So if fat's been injected into the hip and butt region, you do not want to sit in that area for about a month after the operation, because that can cause that fat to reabsorb, okay? So you really want to be cognizant of that. So sleeping on your stomach, maybe sleeping on your side, having lots of pillows underneath you to kind of offload the pressure that's on your butt and hips is going to be really important. Lots of different things that we can certainly talk about, post-operatively to make sure you can do that. The other thing that can be worn post-operatively is a device that's called a faja device, and it's basically this type of compression girdle that is available online, and there are lots of different brands out there, and we can guide you along in that process. It provides nice, even compression to the areas where you want it to be, and then avoids compression on the areas where you don't want it to be. But regardless, after the operation, you do want to wear some type of compression for about a month after the operation. And once again, to emphasize, you want to make sure that you don't have any direct pressure on the butt and hips for about a month as well. If you do need to sit on your butt, to use a bathroom or to travel, that's perfectly fine. You need to do that, you need to live, but you don't want to do this for hours and hours on end. Super important. So then when you do come back at that post-operative visit about a week later, we'll take a look at all the areas, a surgical site. We'll make sure, there are no signs of bleeding or infection, that you're doing well. We want to make sure your pain's controlled. I do give you several pain medications, both opioid and non-opioid pain medications to keep you comfortable during this process. And there's certain anti-inflammatory medications that we may have you use. Once again, we take it on a case-by-case basis, but this is something that we'll certainly talk about to make sure that you're comfortable. And then certain medications as well to avoid constipation, because some patients do develop constipation, and we want to minimize that as much as possible in your post-operative course. When you do come back at that 1-week visit, we'll provide you more compressive, wraps, ACE bandages if needed. If you have your own faja device, you can bring that with you, and we can always try that on during the time. Many patients, it does take a week, sometimes 2 weeks before you feel comfortable wearing another type of compressive device. But regardless, we'll have supplies that we can provide you at your post-operative visit that you can use as well. And then after that first visit, we'll typically have a follow-up visit a couple weeks after that, and then we'll check in with you throughout the year. If you do live far away, at that point, usually okay to head back by plane or by car, and then we'll follow up with you by phone or by video follow-up at that point. But then, of course, if there are any issues, you can always reach out to my office. I'll be available. Someone will always be available to assist you if there are any particular issues. Once you get to about a month, then you can start sitting on your butt. No longer really need to wear the compressive garments anymore. You can start getting back to regular activities. Most patients usually need to take about 2 to 3 weeks off from work or school before getting back into things. A lot of patients, it can be up to about 4 weeks. If you do have the ability to take off a whole month, I think that would be in your best interest before moving back to work or school, really to give yourself that full time to recover. And in terms of recovery, you want to give it time. Initially, you're going to be very swollen, very bruised, entirely normal. So I don't want you to be alarmed by that. And it's usually going to take, several months until you have the final results. For most patients, typically it takes until about 6 months, maybe even up to a year before your final results. So I don't want you to be discouraged. Other things that can help, in addition to compression, is massaging the areas. So massaging the areas where the fat's been taken from. So from the abdomen, for example, or the back. You don't want to massage the areas where the fat has been injected, like the butt and the hips. There's lymphatic massaging, which you can do. You can look online to see how to do this, or you can hire someone who specializes in lymphatic massaging, and that can be helpful. Not absolutely required, but some patients have said they've done it, and they say that it's been pretty helpful. In terms of potential risks of the operation, so this is an operation where patients do quite well, but with that being said, there are always potential risks, always potential complications. So let's start off with potentially big, scary things that can happen, which are relatively rare. So you can get blood clots, so deep vein thromboses or pulmonary emboli, so blood clots that go to your heart and lungs and can lead to issues or problems. Pretty rare. I'd probably say less than 1% chance of that happening. We do give you certain medications, and we also make sure that you get up and move around after the operation, pretty quickly. Those are measures that can help to ensure that those blood clots don't happen. So once again, medications, around the time of the operation to prevent blood clots, getting up out of bed. And we also have what are called these sequential compression devices, but squeezy things on your legs that also help prevent the development of blood clots or deep vein thromboses. Other things that can happen, so getting what are called fat emboli, where fat. So if fat is injected too deeply into the muscle in your butt, it can go into a vein, which can travel to your heart and lungs, and that can cause problems referred to as fat emboli. And the chance of this happening is, probably 1 in 20,000 or so. So it doesn't happen that frequently. And this happens more so in cases where the procedure is not done appropriately or in a technically sound fashion. Right, and so what's going to be important is at the time of the operation for me, so once again, as a board-certified plastic surgeon with a lot of experience, I know how to ensure safety. So once again, it's about injecting the fat in a very superficial layer, not going too deep, staying away from blood vessels to ensure that this doesn't happen. But once again, that's a potential risk, relatively rare, but something that you should be aware of. Other, relatively rare things that could happen. So damage to underlying organs, damage to your intestine, damage to, abdominal organs. Once again, very, very rare. This is going to be an issue of, of kind of technical, expertise, or if you've had a history of prior abdominal trauma or abdominal surgery, that might make you more predisposed to that. But once again, still pretty rare for something like that to happen. But once again, just wanted to lay that out to let you know so that you're completely aware. So what are more common things that can happen? I already talked about it. So the pain, discomfort, swelling. Most patients really only need the stronger pain medication. I would say for probably about 5 days or so, sometimes less. But usually by about a week, most patients are off the strong pain medication, the opioid type medication, or just sticking with Tylenol or ibuprofen. In most cases, I do actually allow you to start using NSAIDs or anti-inflammatory medications even right after the operation, but we do once again take it on a case by case basis. You can have what's called a neuropathy or neuropraxia. So this is basically when your nerves are really inflamed and it's really uncomfortable. Can sometimes get this burning, shooting electrical signals that can happen in the abdomen, that can happen in the legs. This can happen just from the trauma of the operation, where nerves get overstimulated, overinflamed. There are medications and exercises and physical therapy that can help with that, but this will typically go away on its own after a couple of months. So that's something to definitely be aware of. Another thing is, having lumpiness or having fat that reabsorbs or having unpredictable results. So I'll certainly do everything that I can as your surgeon to ensure that you have a good operation, good results. I'm certainly not going to leave the operating room until I feel that you have a good result. But once again, there's always going to be some degree of unpredictability in terms of how your body heals. So if that's the case, we may have to come back and do a revision, and we'll work with your insurance to try to do that. But I tell all of my patients, there's about a 15 to 20% chance that you might need a revision or a redo Brazilian butt lift. So that's something to always keep in mind. And typically, We won't make that determination until about 6 months or so down the line. So you really want to be patient. So if you had 1 month from the operation, you feel that things aren't the way that you want them to be, I don't want you, to dwell on that. I want you to heal, focus on, really just taking care of yourself, and then getting that inflammation under control. And then once we get to that 6-month mark, things don't look the way that we want it to, we can always talk about revisions and things that we need to do. Scarring, there's always a concern for scarring. So using silicone scar cream over the injection sites and the cannula sites is going to be important. Typically, you can start using that at about 2 to 3 weeks after the operation. If you've had an abdominoplasty, or if you've had a brachioplasty, which is taking tissue from under the arm, or other types of skin excision procedures, then practicing meticulous scar care is going to be important. So once again, using silicone cream, silicone tape. If you have a predisposition to developing keloids or hypertrophic scars, or to really raised thick scars, then we might preemptively use Kenalog, or a type of cortisone, which is injected throughout the scar. Or I may refer you to a skincare specialist to get laser treatment post-operatively. But there are lots of different things. So if I do know that you have that history of developing really difficult scars, or really pronounced scars, there are lots of things that I can advise you on to ensure that we can keep it under control. So I think the key thing, that I want you to take from this is that, my job is to make sure that I can meet your goals and expectations. Brazilian butt lifts and body conformation, gender affirmation surgery, and body feminization is about creating, for the most part, that hourglass figure. So a cinched waist, fuller hips, and buttocks. We'll have discussions with pictures. You providing me pictures is important. You being open and honest in terms of your medical history, psychological, social history, surgical history is going to be super important. And I think there's also, going to be some degree of unpredictability. Once again, I will do everything that I can to make sure you look good, but we have to accept the fact that there can sometimes be unpredictability. And if things aren't the way that you want it to be, we can always come back, do a revision if necessary. And what I tell all of my patients, I think any operation in and of itself is going to be the easy part, right? Because that's a couple hours in the operating room. The hard part is the time that you spend preparing for the operation, and then even more so the time after the operation for healing, for recovery, physically, mentally, emotionally. You really want to take those into account. And I'll do everything in my power to ensure that I'm going to be here for you, to support you in that process. Once again, it's an individual journey. Everyone's going to have a different, take on the process, different goals and expectations. And certainly I will listen to you and guide you along in that process to make sure I can meet your goals and wishes for body gender surgery. Appreciate it. Take care.